New at 5, the health community is responding as updated guidance is changing the recommended age for women to start getting screened for breast cancer.
Ashley Smith takes a closer look at the new guidelines aimed at saving more lives through early detection.
Portia Richardson was diagnosed with breast cancer at age 44.
I had a mammogram done in February prior to my diagnosis, which came back completely normal. And by June, I had a palpable mass.
She says routine screenings were critical in catching the disease early. Last week, the United States Preventive Services Task Force finalized its breast cancer screening guidelines, lowering the recommended age to 40 for most women of average risk.
The last time the USPTF guidelines were updated was 2016. And a lot has gone on, and the science has changed, and women's risk has changed.
Dr. Bruce Waldholtz with the American Cancer Society says the lowered age aligns with guidance from ACS, but the two groups differ on other recommendations.
The task force guidelines recommend stopping screening at age 75. The American Cancer Society guideline is if a woman reaches age 75 and still has 10 years of expected life expectancy, to continue screening.
The update also aims to address racial disparities in breast cancer rates.
Black women have a 40% higher chance of dying from breast cancer.
There are calls for more research in this area and surrounding dense breast tissue, which the task force notes nearly half of all women have.
Women now are going to be receiving notice that on their mammogram they had dense breasts.
Dr. Waldholtz believes the key takeaway is that cancer screenings save lives. Portia says women must be proactive about their personal health.
Continue to be the squeaky wheel, until you are heard and you are able to get tests done.
Ashley Smith, 13 News Now.